Okay, so here is your program that is going to be dedicated to improving your shoulder mechanics. If you're dealing with something like impingement, what we're focusing on is actually allowing these 2 points of our humerus called our tubercles to clear our clavicle or collarbone when we lift the hand up. Now, if we go palm down, what ends up happening is that those two bony ridges will actually come in contact with that collarbone, causing a pinch and pain. What's interesting is that once you get past this painful arc, it's relatively pain-free. So what we need to do is actually reposition the shoulder blade. And so we're gonna start from the most basic and then transition to a little bit more active motions. The first key is to actually control your breathing. We wanna focus on specifically when you're taking a big breath in, you're breathing in through your nose and then breathing out. And as you can tell, at the top portion of my breath, my shoulders do rise, but it's not the first thing that elevates when I breathe. Ideally, when I'm breathing, I want my abdomen to expand first, then my chest, and then my shoulders to the topmost portion of the breath as compared to, and so you can focus specifically on every hour or so, you give yourself an opportunity to do 3 to 4 deep nasal breaths, 4 seconds in, 4 seconds out. A much more involved approach would actually be doing this on your back. And so ideally, you'll lay down with your knees flat on the floor or table. And what you're going to do is you're going to put your hands on your abdomen. And from here, you're going to go a 4-second inhale with your focus on actually expanding your belly button, then your chest, and then your shoulders, and then breathing out, giving every ounce of energy out of your body, or every ounce of air out of your body. Again, focusing on that nasal breathing will allow these to actually relax, allowing your shoulder blade to move a little bit better. The next thing that you're going to do is you're going to take a roller or a bolster, something soft or firm depending on your comfort level, and you are going to be placing it underneath your shoulder blades. I have my firm roller right here, but you can absolutely use a softer one, giving you a little bit more leeway. You're going to keep your butt onto the table or floor, shoulder blades right on top of the roller, hands behind your head, and then from here, you're going to keep your ribs tucked, elbows in together. You're going to lean back and then back up. Lean back, back up. If you feel a couple pops and cracks in your shoulders and your upper back, that's totally fine. But the goal is to ensure that your elbows are forward and not out towards the side. You're going to do about 15 pulses for that specifically. Those are going to be the prime activities that you're going to do when you are on the floor or on the table. One thing that you're going to do when you're standing requires no equipment is going to be a chin tuck. Now, the idea is that when we are in fact doing our chin tuck, the focus is actually elongating the spine. So taking the crown of your head and driving up towards the ceiling, and you're doing that by tucking your chin. And if you look at me from the side, I'm doing this kneeling just so I can stay in the frame, but I could do this standing up. I'm going to be looking ahead, and oftentimes my shoulders will be drifting forward. So what I'm going to do is actually drive my head back, and as you can see, my spine does elongate, and you'll see that my shoulders will also peek back as a result. And so you don't have to necessarily hold it, but you're gonna go ahead and push your head back, hold for a second, and then relax. As you can tell, my airway does change up a little bit, which is why you don't necessarily need to hold it. It's going to be a pulse and then back, pulse and then back. About 10 to 15 repetitions every hour or every 2 hours when you can. The next thing that you're going to do is I like to call it a pec stretch. And the pec stretch, you're going to be doing it up against the doorway. What we want to focus on specifically is having your hand probably maybe a little bit below your shoulder. If you have your hand up a little too high, it can become a little painful. So you're going to find a doorway and you're going to have your hand down to maybe below your shoulder height. And you're going to have it so that your hand and your elbow are up against the wall, and then you're going to press. You are actually going to press your chest through as compared to pushing your head through, because that'll crank on your shoulder. Okay, so I'll show it on this side. Hand here, here's the wall. You are going to press your chest forward and back. what you'll notice if done correctly is that you're gonna feel tension right here. It's gonna be halfway between your nipple and your shoulder. There's a band of muscle right there is what we call the pec minor. Ideally, you want to stretch that out, allowing the shoulder blade to actually get a little bit more in a better position. So you're gonna do that about 10 to 15 times. See the difference between the left and the right. And then the last thing that you're going to do, I like to call it the hitchhiker. The hitchhiker, it's going to be focusing on specifically opening up the shoulder, working on the posterior aspects of the shoulder and the socket as well. And the reality is that, here we are stretching out the pecs, but we also have to strengthen the backside as well. And so the hitchhiker, you want to make sure that your elbow is kind of in line with your body. Your arm is going to be at about a 45-degree angle, and you are going to focus on actually having your thumb go back. What you might notice is that the back of your shoulder is going to cramp up, but the goal is to actually set that shoulder back in place. You don't have to worry about setting your shoulder back. What's nice is that as you go, your shoulder blade will come back into the normal position. I recommend about 15 repetitions every hour or so, especially to negate a lot of that forward movement that you have with this arm. We're just reversing that motion.